Welcome back, everyone. Time now approaching 8:22 on this Monday morning. While the medication your doctor prescribes you may help one problem, it can create others. Sometimes they deplete you of nutritional vitamins, sparking a whole new set of health issues. I spoke to Dr. Peter Osborne, a nutritionist with Town Center Wellness in Sugar Land, about what you can do about it. Out of your Catherine's concerned about some warnings on her prescription drugs that talk about the fact that it could cause vitamin deficiencies. Do you have a suggestion for her?
Well, there are a number of medications that have known depletion effects. So a patient might be taking a medication that causes a vitamin or mineral deficiency. Unfortunately, this is not taught in medical school, so a lot of doctors are just not aware of these side effects. And so the suggestion I would have for her is to have a conversation with her physician about this potential concern and maybe have him look at running some lab tests to identify.
Is that pretty prevalent among prescription drugs? Do a lot of them cause you to be deficient in?
Almost all of them do. But again, the difference is certain medications will cause depletions of certain things. One of the most commonly used medications is for cholesterol lowering. Those drugs are called statins, and those particular medications are known to cause CoQ10 deficiency. Coenzyme Q10 is a vitamin, and its job is to help our muscles stay strong, to help our heart stay strong, and to give us energy. So a lot of the times when people have these medications on a long-term basis, they end up developing a lot of fatigue, a lot of muscular pain, and they can actually even develop neuropathies.
And so all of that is just because they're taking a prescription drug for something else and they don't realize that that's the problem. Where do they begin? If they have those symptoms, that seems like anything almost could cause that. So they probably wouldn't expect or suspect that this would be their prescription drug.
Well, they might not, because a lot of the times the prescription drug, the effect it has on nutrient levels might take 2 to 3 years to achieve a level that they become symptomatic. And so they don't even suspect, oh, okay, it's this drug because I've been doing it for 3 years. So they may not even have that suspicion. To me, if a doctor's going to prescribe a drug and we know that drug will cause a long-term nutritional deficit, then it also falls on the shoulders of the doctor to be responsible enough to measure his patient's vitamins and mineral levels.
But if they're not, then is it just important to really look at those warning labels and then perhaps talk to your doctor about being tested for those?
I think that would be a great place to start.
Okay. Dr. Osborne, thanks for your help today.
Thanks.
We have all kinds of tips for you on our website, so you'll have to go there, check it out. I'll show you some different vitamin deficiencies and the symptoms they cause, and then what kind of testing you can go about to help out. I'd like for you to contact me on Facebook or Twitter. All my information was just on the screen there for you. You can ask me a question. I can ask a doctor for you, and it's just a simple way for me to be able to help you out, the viewer. Hey, we have something interesting.